In this workshop, we would really like to emphasize the principles and the concept, maybe also give you a little bit of a sense of the methodology, but it's not possible to do it in a very quick way. What we are using in the next two presentations is part of the slide decks that ICD, WHO, FAO have brought together and that are publicly available with speaker notes. So we will use two for this lecture, topic 3, lectures 1 and 2, in a slightly abbreviated form. And then in the next one, we'll use the topic on Listeria monocytogenes as a case study for a risk assessment. So the aims of this presentation are to give you the basic understanding of the process of risk assessment, the purpose of risk assessment, and illustrate some of the outcomes. Risk assessment, as you know, is the scientific part of risk analysis, the overarching framework. The risk assessment is really there to establish the severity of an illness. So how impactful is an illness on consumers, and how probable is it that this illness will occur? Risk assessment is there to support risk management. Risk management decisions are made in governments in the context of codex. There can be a confusion also because in industry people talk about risk management, of course, and there may be risk managers functions in industry, but in the context of let's say this presentation, when we talk about risk management, those would be managers in competent authorities. So they need, as one of their responsibilities, to assess how hazards may impact on the population. They have to protect the population from undue impact, and they have to design programs that continuously improve the situation. So risk assessment is not the start of, it's not where risk managers start. Risk managers have preliminary activities, as it is called in the framework. They investigate the issue roughly. They may make a risk profile, for instance. They may have a preliminary discussion with risk assessors. What do we know roughly? Do we really have to go into a full risk assessment? But at some point they may decide that a fuller risk assessment is a good thing to do because of the complexity of the issue at hand, for instance. And following the risk assessment, they can then evaluate what risk management options are, let's say, coming out of the risk assessment, and how those risk management options could be implemented. They have to communicate to stakeholders about the implementation. They have to, for instance, communicate to industry how certain measures might be implemented. They have to assess how well implementation will be, maybe think about capabilities in the industry, and then make a final decision about implementation. They have to then also monitor and review, obviously, to see whether their measures have the required effect. So risk assessments answer risk management questions, but to do that, the risk assessment has to be adequate to answer the questions, and very often it helps that it is well structured, so that in the whole process, risk managers and other stakeholders that read the risk assessment understand at what stage of the risk assessment they are, what actually the purpose of the exercise is. Risk assessment should be sufficiently descriptive, so that it characterizes well what we know and what we don't know. There are many data gaps in risk assessments, and they can be there because we cover them with reasonable assumptions. But sometimes you can discuss, of course, how reasonable an assumption is. Maybe there's research needed to cover a data gap. But that description needs to be quite good, so that we shouldn't only put down what we know. Very important also to put down what we don't know, or whether we are uncertain about what we know. And that adds to the transparency of risk assessments. Even in the use of good, sound science, there can be a bias. there can be different views on science, and it's very important that risk assessments are transparent in that respect to allow others, peers or stakeholders, to have comment on the risk assessment. Very basically, things you probably already know, in microbiology we call a hazard the microorganism, the agent that causes the adverse effect. In toxicology, it's the endpoint in many cases. That's called the hazard. When we have a hazard, just the mere hazard isn't a risk, but when the hazard exposes, when a consumer is exposed, there can be a more or less severe impact. The combination of whether exposure is possible and how severe the impact is what we call risk. So there can be very different risks if you have hazards that are very different in severity, when you have exposure being very different in likelihood. A very simple illustration to show risk in different dimensions, so the different magnitudes of risk. If you want to cross the street and there are two potential hazards on that street, a bike and a big truck, you can do a quick risk assessment and see that the truck is a very big hazard, would be very severe impact, it's very close to you, and the bike is somewhat further away and might not be a very big hazard if you are exposed to it, if you're hit by it. So very simple illustration to show those differences in risk. Risk assessment is done in many disciplines, scientific areas, in chemical, microbial, but also in, let's say, biotechnological sense of risk. Importantly, there are many building blocks underlying those risk assessments. You need many different expertises. Expertise in modeling, expertise in data generation, expertise in understanding the science, the biology, the chemistry of things, the epidemiology. So it's a very complex source of data that you may need to put into your risk assessment. So you also would need, in many cases, resources, skilled people that work in these areas. So there is another difference between chemicals and microorganisms that I would like to point out. Chemicals don't often have an acute effect. Maybe in the sense of allergens, that is a different one, but most chemicals would have a chronic effect. Many hazards can be mitigated at control at farm level, for instance, in terms of chemicals. Manufacturing may have little effect, maybe sometimes dilution as an effect. And there are processes, we have defined, let's say, processes, scientific processes of CHECFA and other organizations that with the management activities following give us acceptable levels. And we don't always have the same acceptable levels for the same components in different countries, but they're often following a similar process. And also different in chemical risk assessment. Animals may be used, or substitutes for people may be used that give a sense of which low level is a no adverse effect level, and then safety factors are added to come to acceptable levels. In microbiology, it works slightly different. Most microorganisms are acute. Within, let's say, the time scale of a week, there will be impacts very severely, or even a night. Then many hazards cannot be necessarily effectively managed at farm level. And during the value chain, there may be very many changes in microorganisms. They may come in newly, they may grow, inactivated, regrow. And acceptable levels are not really defined. We have mechanisms like, or principles like microbiological criteria, which define acceptability of a food. We may have in law limits to microorganisms, but these are not necessarily acceptable levels as defined, as ADIs would be defining. And in the risk characterization, we look for the effect, not using necessarily safety factors, but we will look for limits that are kind of black and white. Over the limit, it's unsafe, under the limits is not safe. So there are some differences. What risk assessments don't define are acceptable levels in microbiology, because the acceptable level is a risk management decision. What risk assessments do define are, let's say, is the information source, the information that risk managers can base their decision on. Microbiological risk assessment was developed very early on for well-known pathogen commodity combinations like Campylobacter in poultry, Listeria in ready-to-eat food, Salmonella in eggs. And often these were single pathogen product combinations that were investigated. So a lot of effort in that regard goes into one single pathogen in one food chain, because really of the complexity of that food chain in many cases. And risk assessments help to unravel that complexity and help managers make decisions. There are many inputs needed in risk assessment. Keep talking about the data and the knowledge of experts. You also have to have your tools, statistical tools, ranking tools, simulation tools for probabilistic risk assessment, for instance, Monte Carlo. And in many cases, we don't have data, hard data. We may have to go to experts and ask them for their opinions, so expert elicitation. And then we need to have the infrastructure in countries that we have been discussing yesterday as well. How do you get your data? How can you generate the data? So you need your infrastructure there to look at the epidemiology, the food consumption data. Outbreak investigation can give you data. Consumer behavior is maybe one of the most variable, unknown factors here. There are different types of risk assessments in microbiology. Looking at one pathogen in one food, product pathogen pathway risk assessment is what it's called. Risk ranking, looking at maybe one pathogen in different foods, and then looking at what foods would be in which foods it would be most risky. Geographical risk assessments, for instance, the spread of TSE, BSE was done in a form of a geographical risk assessment, and you can also have risk trade-off risk assessments, where, for instance, in this example, nitrite, as also Kieran said, may be added to sausages to control Clostridium. Nitrite is a chemical that carries risks in itself. So the benefits of controlling Clostridium can be balanced or can be investigated versus the risk of nitrite. Outcomes of risk assessment can be simply defined as the chance of a person falling ill after consuming a serving of food. It could be a population level risk assessment, so per 100,000 people in a country in a year, what are the number of cases? The relative risk, comparing different foods where a pathogen can be present, and maybe risks related to different handling, different distribution, that could also be ranked as risks. There's an example of how such a risk estimate could be expressed. So in the US, eating a serving of shell eggs might carry a risk for salmonellosis of 3 times 10 to the minus 6. Coming out of a risk assessment, this is a number. It doesn't mention the uncertainty. It doesn't mention any data that were used. So using these kind of numbers in isolation is slightly dangerous. We always say that the risk assessment itself, the process, the bring together the data of the risk assessment is much more important than the end number, because the end number doesn't give you a lot of sense in itself. On a population level, such a risk could be coming up to 30 cases of listeriosis, knowing that there are 280 million inhabitants. So you can also, let's say, look at the population level risk per 100,000 of people, for instance. Risk ranking, as I said, could be an outcome, and this is a picture of a risk assessment done 10 years ago on Listeria and ready-to-eat food, and they investigated 26 different foods that Listeria could be present in, all sampled at retail, and it went from fruits, vegetables, milk, pasteurized, unpasteurized, to ice cream and hard cheese, for instance. And after ranking, you can see that some products are highly risky, relatively, and some are not. So here would be ice cream, hard cheese. Pate, smoked salmon would be the most risky products. So these are exercises that can point the government to where the risks are highest, where to investigate more, where to be more looking for controls that are not in place. And the US government has used these tools exactly for that purpose. And also to justify that they wouldn't go to ice cream factories and other factories where risks were low. Other outcomes could be, for instance, that you have you get a view of how shortening shelf life or lowering temperature could mitigate salmonella risks in eggs. Compared to the baseline shelf life of 14 days, half that shelf life or lower temperature could reduce salmonella risk by half or more. So you get a sense through these exercises what controls would give you what outcome. Risk assessments need to be done for, let's say, a population in a country. So it's also very important to understand what is imported in a country, what products are imported, and how that may add to the burden of illness in the country. And those data are often difficult to get. Early risk assessments were done in individual countries, academics in countries, later picked up by governments as well. And here are some examples for Canada, the US, the Netherlands of some early risk assessments. And to the left top, those kind of risk assessments were then somewhat later pulled together by FAO WHO to have those global risk assessments we talked about yesterday. It's very important that risk assessments are very transparent, as we said, and do note key assumptions, because risk managers need to understand what key assumptions were made. That gives them a sense of, let's say, the comfort that risk assessors have in the outcome of the risk assessment. They have to be inclusive. Sorry, they have to be sure that if risk assessors are not conclusive, or if there are, let's say, controversial issues, that these are noted down as well. And that estimates of risk really come with, let's say, that sense of how sure are we about this outcome? What is the, let's say, the variation, the variability that we would see? So the risk assessment, as we said, is the domain of JECFA in terms of international risk assessment, risk management, or JMPR, and in microbiology it would be GEMRA. Again, like mentioned yesterday, GEMRA output or output of JECFA and JMPR goes into standards, goes into, for instance, the standards of Codex Food Hygiene, Codex Pesticide Residues Committee, Food Additives Committee. So it's really a good cycle of use, put to a good use those risk assessments. The principles of risk assessment are published for microbiology in this Codex book, this Codex guidelines. The main purpose is to answer risk management questions. So risk assessors should really not work on their own without, let's say, this interaction with risk managers, iteratively maybe checking with risk managers, are we on the right track answering your questions? Of course, sometimes that kind of responsibility is a little bit split, like in EFSA and the DG Sanko. EFSA really has become, in a way, more independent than the principle of risk analysis would define. EFSA has received the mandate that it also can do risk assessments by its own means, by its own initiative, rather than being asked by countries or by DG Sanko for doing a risk assessment. So just going through risk assessment maybe with a little bit different perspective, looking at each of the individual steps, what the purpose is of the step, and what some of the challenges are. So these are the 4 steps of risk assessment. First one being hazard identification. As was mentioned, it's not always easy to identify the hazard. You need to investigate and invest in resources and skills to do that. Hazard identification may be started by risk managers in their preliminary activities, but the first thing a risk assessor should do is to really confirm that the hazard proposed by the risk manager is the pertinent hazard to investigate. Otherwise, resources would be wasted on an irrelevant hazard, of course. What also should be done by the risk assessor is to note whether any other hazards not noted by the risk manager would also be important, equally important, or maybe even more important in terms of risk, because then risk managers can decide, well, do we change the scope? Do we change the questions for the risk assessment? Risk assessments are often, let's say, conducted in a reactive way. Risk managers know there's a problem, and they need the risk assessment to investigate in more detail how this problem pans out in terms of risk and what are possible risk management options. But it can also be done proactively. If we see an emerging issue, if we think there are new products on markets, we can start making risk assessments, maybe not having a lot of data, maybe with uncertainty, but completing that risk assessment over time to keep a good view on how a potential risk might develop. The second step is hazard characterization. We talked about that a lot already. That's really trying to understand the microorganism in detail, the hazard in detail. Is the hazard infectious? Is it producing toxins? What is the root cause of illness that we see in consumers? Ideally, we quantify that kind of information so that we can use it in models to calculate impacts. So there are, let's say, three contributors to variability in hazard characterization. Food can, let's say, have an impact on the microorganism or the consumer in terms of how a hazard impacts. Certainly the pathogen in terms of number, how viral the organism is, whether it produces toxin, as I said. The host, also Kieran mentioned, you have different vulnerabilities in hosts due to age, health status. And you could very roughly say that you, of course, have the generally healthy normal population, and next to that you could have several different possibly susceptible individuals. Sometimes very young, very old can differ. Pregnancy can have an impact on susceptibility. When we are able to quantify the hazard in terms of a dose and the response of the consumer, so the hazard dose exerts a response in the consumer, we often try to, let's say, picture that, put that into a graph. On the right, if you put it in a log scale, you could see that there is a, let's say, a straight line. There's an increase in the probability of illness with higher numbers of a microorganism. In fact, there are no thresholds in microorganisms. There's always a defined, very small risk of an organism having an impact. So this straight line illustrates that well. What this straight line doesn't illustrate is the variability between microorganisms, variability between people, and this kind of graph would illustrate that much better. So while you have some, maybe when you can, although you can derive such curves, there is a lot of variability because consumers vary a lot in their response to microorganisms. It's not easy then to calculate a defined number at the end of a risk assessment. So there are many issues in risk characterization. It's very labor-intensive, data-hungry, but we don't often have the right epidemiology data. We use sometimes also surrogates, animals that relate badly to impacts in humans. The pathogens may vary a lot. As I said, the matrix could have an impact as well. So a lot of uncertainty often in this kind of step in hazard characterization. The next step, exposure assessment, goes to investigate at a specific point or throughout the value chain how the level of the organism changes ultimately up to the point of consumption. If it's not the level of the organism, it can be, let's say, the level of the toxin, of course. And for instance, when we do a product pathogen pathway analysis, we look at primary production, transport, we look at manufacturing and transport again, at retail, at food service, or at home. We look at all those points to understand the level of the organism relative to what is happening in that step. So what is done in terms of handling, processing, environmental conditions such as cooling. And for every step, you can have a mathematical think through with the H0, what is the hazard level coming in? And there may be a sum of measures that give you a reduction, and there may be a sum of conditions that may allow an increase. So you kind of add up those different blocks to come out with the hazard level at the end. So, as I said, a complex situation, specifically if you investigate long supply chains, complex supply chains, and very important to understand the level of the hazard, as I said, but also the frequency of the hazard occurring, because that is another variable that is very important. And very often with the methods we use, it's hard to quantify both frequency and level. We don't necessarily generate these in surveillance, normal surveillance systems. We would do maybe if we investigate an outbreak. But so these kind of data are, or if you as a country decide risk assessment and this kind of data is important, surveillance systems might have to be adapted to more, let's say, systematically generate the level of organism next to frequency of organism data. So there are these kind of exposure assessment issues. One element of exposure is consumer behavior, is how much consumers eat. Those data are also very, sometimes not existed, but also sometimes for very specific categories, for very specific products, or not specific enough. That can vary as well. And some data are collected for data investigation, for outbreak investigation, which don't give you the normal situation. Then let's go to risk characterization. That is the stage where we put the data together, we put our insights together. You may end up with a curve like this again. Looks like at some point the risk will start coming up. But as I said before, only this as an output would not give you good guidance as a risk manager. You really have to understand what this line depicts. How certain are we about this line? What is the variability we see that needs to be accounted? And are these models valid? Are the models we used really valid? I would like to point out two things before I close, and that is terminology related. So we keep talking about variability and uncertainty. And variability is importantly a fact of nature. If we would investigate more, we might understand the variability better, but it's not going away. It's just a human variability, is biological variability. And that's important to understand. Uncertainty, on the other hand, is our ignorance. It's what we don't know. And investigations may give you less uncertainty because you know better. And these factors can then help narrow down, let's say, the variability around outcomes. And just one last point. In many risk assessments, we work with single numbers. Input on consumption, input on microorganism levels are single numbers. So out of the risk assessment come single numbers. It's getting more and more popular to use distributions as input to capture the variability or uncertainty in those distributions. And then you also get a distribution as your outcome of the risk assessment. In risk management terms, having a single number is possibly easier to manage with than a distribution, because who decides where in the distribution you think something is safe? And sometimes these distribution models also overestimate at some point risks which need to be pointed out in the risk assessment. So these were, let's say, some of the thoughts that we think are important, some of the principles that are important, also when we go into the exercise later, because this terminology will come back in that exercise.